Okay, so my name is Allie Elmore, and this is my Foley catheter insertion. So I see here that my patient is due for a Foley, so I'm going to go ahead and check on her. Hi, Ms. Knight. I'm Allie Elmore. I'm going to be your student nurse today. Could I just have you give me your name and date of birth? Charlene Knight, 8836 or 39. She is allergic to latex penicillin and betadine. Okay, so I have here that you need a Foley insertion, so I'm just going to go ahead and check your perineal area, if you don't mind. I would go ahead and do my hand hygiene. Alrighty, I'm just going to take a look just below your waist. Alright, pull this back. I'm going to go ahead and lift up her legs, like so. Alright, I would go ahead and palpate her bladder. It does feel a little bit distended. Alright, and then I would check her perineal area. I do see the meatus. I don't see any signs of discharge, so I don't see any reason why you can't go ahead with a Foley insertion. So I'm going to go ahead and cover her up for now just to keep her warm. I would go ahead and take off my gloves. Put it in the trash. And hygiene. Alright, I'm just going to compare my Foley with my provider's orders. It does say that she needs a 14 French Foley catheter. This is intact, dry, and I don't see any signs of damage. So I'm going to go ahead and lay it on a dry surface so that I can begin. Okay. I'm going to go ahead and rip off this, throw it in the trash. I'm going to slide out this. I'm going to go ahead and make this my trash can. I'm going to go ahead and lift this up. Alright. Remove this. Alright, I'm going to go ahead and start. I would pinch the outside layer of the outside flap and fold it away from me. I would next take the next fold from the outside, staying within my 1-inch borders, fold it to the left, take the next one from the outside to the right, making sure that it doesn't fold back on itself. Take the last one, come back, I'm going to turn it so it's a little bit easier for me. Okay, and that's good. Alright, first I'm going to pinch the shiny part of the blue, I'm going to stay within my 1-inch borders and help let this fold out. I'm going to lay this shiny side down, and I'm not going to let the this side, the not so shiny side, touch my patient. So I'm just going to go ahead and drape this below her. Alright, next I'm going to put on my gloves, but I'm not going to use these, I'm going to use my own. So I'm going to go ahead and pinch, drop those over here. I'm not going to turn my back on my sterile field. I'm going to open these. That's trash. I'm going going to open up my gloves. Open them from the bottom. I'm going to slip my fingers under the slits. Thumbs on top. Open. I'm going to pinch so it doesn't fold back on itself. I'm going to take my non-dominant hand, pinch the outside part of this, step back. I'm going to insert my dominant hand in here. Careful to not touch the sterile parts. And slip it on. I'm going to put my fingers under this cuff. Careful to not touch the outside. I'm going to watch my thumb so it doesn't touch. I'm going to slip my hand in, supinate it, and I'm going to slip it in, and I didn't quite get it, so I'm just going to rearrange because both hands are now sterile. I'm going to interlock my fingers. And I'm not going to touch the bottom cuff down there. I'm going to do away with that. I'm going to move this over here. I'm going to straighten out my box. I'm actually not going to use this. I'm going to open my hydrogen peroxide. I'm going to step back. That's trash. Now I'm going to pour it on my cotton balls. Careful to not let it splash on my sterile field. I'm going to pour it all over the cotton balls. And that is now trash. I will now step away and open my lubrication jelly. That's trash. And I'm actually going to put it on the inside of my box. I'm not touching the 1-inch border, but I am going to fold that. I'm going to put this inside the box so I can lubricate my catheter. This is trash. I'm next going to take out my catheter. I'm going to remove this because I don't need it for this. I'm going to keep control so this doesn't flop around. I'm going to lubricate the end of this, the first couple inches. This is trash. Okay, that is lubricated. And now I'm going to exercise my plunger. I'm going to step back, pull it back a little bit. It's hard. And I'm going to do it just enough so that no liquid comes out. And I'm going to go ahead and place this right on the port here. And if the instructions said to inflate the balloon before insertion, I would do that, but this one does not, so I'm not going to do that. I'm just going to lay everything here. I'm going to put this on top. I'm going to bring this over to my other sterile field, and I'm going to dry it. Alright. I'm going to go ahead and clean her perineal area. Miss Knight, I'm going to go ahead and apply some wet cotton balls. I'm now going to make this hand unsterile, and I'm going to spread her labia. And I would now take the first cotton ball and clean the outer labia that's farthest from me, come around and drop. I would clean the outer labia closest to me, come around and drop. I'd clean the inner labia farthest from me, come around and drop. Keeping my unsterile hand there. Clean the inner labia closest to me, come around and drop. I have a couple extra, so I'm going to go down the middle. And I'm going to do it one more time with an extra cotton ball. Come around and drop. Now done with that, I'm going to put this over here. I'm keeping my hand on the inner, my unsterile hand on the labia. I'm now going to insert the catheter. So I'm going to ask you to bear down, Miss Knight. You're going to feel a little bit of pressure at your meatus. I'm going to be careful to not let my sterile hand touch the vagina. I'm going to keep this about 2 to 4 inches away so that I'm sure not to make my sterile hand unsterile. My unsterile hand will not touch my sterile hand. I'm going to go ahead and insert, bear down. Okay. I'm going to go in 2 to 3 inches until I see, and I do see urine now, so I'm going to go in an extra inch. Alright, now I'm going to take my unsterile hand and secure this here. I'm now going to insert 10 milliliters of water into the balloon. And she's not in pain, so I'm in the bladder, not the urethra. Alright, I'm going to go ahead and detach this. The sterile procedure is over. I would take this, the bifurcation, at her inner thigh, and then I would place this on the bedside, not on the bed rail. And I would look to see if there's any cloudy urine. I would try to make sure that it's clear and free of sediment. Ms. Knight, I'm going to come back once every shift, at least, or every 8 hours to check up and to do perineal care. And I'm also going to check to make sure that this is actually in the bladder, which it is. I'm getting no tug back, or it's staying in. So I will document and come back soon.